Okay. All right. Hi, my name is Courtney Herzet. I'm doing my poster over the impact of physical activity and exercise on chemotherapy side effects. So kind of the reason why I got into this poster was I currently am a CNA on the oncology unit at St. Francis in Wichita. And so I deal with a lot of cancer patients going through chemotherapy. So a little bit of background about my research. There's about 650,000 cancer patients that receive chemotherapy each year, and this is outpatient. That's not even inpatient in the hospital. Many side effects of this includes hair loss, nausea, vomiting, pain, weight changes, and there are so many more. And typically, like the doctors just give medications to these patients to help with these side effects. So my research question was, in oncology patients, does participation in physical activity and exercise compare to lack of participation in physical activity, exercise influence side effects while receiving chemotherapy? So I wanted to take more of a non-pharmacological way of how can we help these patients and their side effects while they are on chemotherapy. So some of my lit reviews, my first article was high intensity exercise during chemotherapy induces beneficial effects 12 months into breast cancer survivorship. So they studied about 4 common chemotherapy related side effects, and that included energy, stress, and nausea. They had their patients try endurance and resistance training. So endurance would include like running a mile, and then resistance training would be like going to the gym and lifting weights. In their findings, they found that the energy and nausea improved significantly after endurance training, and then energy, stress, and nausea improved after resistance training. And then the next study was a single exercise session improved side effects of chemotherapy in women with breast cancer, an observational study. So in this study, they looked at 240 women who performed high intensity aerobic interval training, which included weightlifting. This training had beneficial effects on fatigue symptoms and muscle strength after 12 months of starting treatment. And then next, I kind of looked at the QSIN quality indicator. So QSIN is the quality and safety education for nurses. This prepares future nurses with knowledge and skills necessary to improve patient care. So 2 of the topics I looked at were evidence-based practice and teamwork and collaboration. In evidence-based practice, you use like the best current evidence, clinical expertise, and patient and family preferences. So this would include like asking the patient if they would like to go on a walk in the hospital, or what kind of exercises that they want to do and how that would best benefit them with our current practices. And then teamwork and collaboration. So this would include physical therapy, nursing, the CNAs. This would take teamwork between us and the patients as well. So kind of collaborating and making a plan of how we need to execute this type of physical activity. After looking at my research, the goals that I would encourage would be that patients would need to exercise at least once a day, and nursing would need to incorporate this routine in the hospital, and that would include with physical therapy, occupational therapy, nursing. So we need to incorporate this in getting our patients up and mobile rather than staying bed rest or in their room, that they need to get up and walk around and try to exercise as much as possible. And benefits, this would help not only improve their side effects, but this would increase patients' activities of daily living and increase great patient satisfaction. And then my recommendations, I think that the patients and us workers need to understand the importance of exercise and encourage patients who are fatigued that they do need to try to get up and exercise, that it will make them feel better, and to try to take into consideration that the time demands and during busy hospital schedules. So right now with short staffing, if we could get extra help with our other coworkers of trying to get these patients up and exercising. And then for further research, just I had a hard time finding research of patients that are in the hospital. I found more research of people who were outside of the hospital going to clinics and getting their chemotherapy rather than being in the hospital and getting their chemotherapy. And then also just exercise specifics. I found a lot about weight training and endurance rather than just walking once a day or doing yoga or something like that. So that would be my further recommendations for further research for my project. And that's a little bit about my poster. So thank you.